you've got different students coming out to you, asking you for advice. What would you hope that they could do to get the most out of you?
Did I retain knowledge and information if the information was spoon-fed to me, or did I retain the knowledge and information if I struggled to come to the answer? My pet peeve is when they have no answer to a question, or they look blankly at you and say, I don't know, what do I do? So I'll throw problems at students and I'll ask them 1,000,001 questions and I'll try and guide them towards the appropriate or the most ideal answer. I would much rather you give me 101 wrong answers than look at me with a blank face.
CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker. Sounds like you're at Toys R Us right now.
Sorry?
Sounds like you're at Toys R Us right now.
Yeah, actually. So I remember describing his clinic as dental Disneyland. So Michael Frazis is a good example of that. He has so much freedom to do what he wants. If you've seen, Right Global and the content that he produces, that's entirely due to the freedom that he's given. And it's not a special privilege that he has over any of the other associates. We all have that freedom.
Mm-hmm. Yeah, so let's dive into that a little bit. So obviously you're in Adelaide at this point, right? You're at a new practice that really aligns with your values and how you want to practice dentistry. You're given a perfect environment as well, where you've got the access to different mentors, great mentors. You've got different tools and equipment that you can access. So, you're in dental Disneyland, right? So how do you, because obviously you can give someone all the tools and everything and the mentors, but if they don't have the knowledge to apply it or use it, they can't. It's like, they can't fully gain the benefits out of it. So are you going to training to, further utilize these skills? Are you jumping into photography so then you can kind of develop it more? I'm just throwing it out there.
Yeah. Most of the dentists there have their own cameras, and we're all open to kind of sharing equipment to an extent with each other, and talking through our different equipments. Michael probably has the most photography toys to play with.
He's got a dental studio.
Yeah, he does. Yeah, he's got the white backdrop and he's got 2 speed lights that are attached to 2 soft boxes attached to the chairs, and he's got a proper studio basically. But there's that kind of what was the question again? I know I'm going to go off tangent. It's guaranteed.
My question is, for you're in an environment where you've got the great mentors, you've got the great equipment, right? But sometimes you have to know how to use it to actually implement it. Are you picking up courses to, help you utilize this to its fullest extent?
Yes. So, I recently signed up to the GDR Shadi Hunt's photography course. And I use that information as well as what I'm taught from Michael Frazis about clinical photography. Again, Dustin, Michael, Wei, there's a couple of other clinicians who are more senior to me, whose photography is absolutely incredible. So constantly badgering them with nonstop questions, talking to, they have a really close relationship with Raina at Toothworks, who's a dental technician, and talking to him about different photography settings. That's absolutely, having that connection and having those conversations allows for you to, again, build more. The key point is there's an opportunity to apply whatever you're being taught then and there on the spot. And the expectation is the moment you learn something, you do it. And we all expect that from each other, which is, again, absolutely fantastic, because it means that there's no kind of wasted opportunity. In terms of the majority of the equipment in the practice, again, Dustin and Michael, they know how to use the majority of it, so they're constantly teaching me. Michael runs a CEREC bootcamp course for Right Global. So again, I have this lovely advantage of, whilst I can do the CPD, I've also got access to the person who runs the CPD mentoring me and working alongside me.
You've got the library. You've got the library.
I do. I genuinely, I have access to a lot of information pretty much right next door to me. And all it takes is a knock on the door and a couple of questions. Yes, I intend to do more courses for sure. I think in the future, I'd like to, actually, I've got a list here. Let's see, where am I?
So let's dive into this a little bit, right? Whilst you're looking at courses, have there been any particular courses that you feel like you didn't find that was beneficial for you at the time, and would you do it differently next time?
Yeah, so the courses that didn't really that I didn't find a lot of benefit from were pretty much every implant course I ever went to, and the simple reason for that is I don't apply it. To this day, I would say that a fifth-year dental student knows more about implants than I do. And the simple reason for it is that I'll go to a course and I'll learn the information, but unless you're applying that clinical knowledge then and there, unless you've got cases coming up, you lose that information very quickly. There's so much that we have to apply on a daily basis already, just as being a general dentist. If you're not actively applying skills, it's gonna go. It's gonna go out the window. At least for me, it does.
Would you say that's the most challenging part of your dental education?
Applying it? Yeah. Well, yes and no. It's not challenging. Ultimately, it's a matter of what's your priorities. So, like I said, with ortho, it's like jumping down the rabbit hole. There's so much to know, to learn, to apply. I've got my hands full with ortho at the moment. I feel like if I tried to delve into implants, I'd probably overload my mind. And I'm quite happy with the fact that, again, in my Disneyland clinic, I've got two clinicians that are very proficient at oral surgery and implants, so I can kind of leave it to them. And there's me and Dr. Wei, who does fixed ortho, so they can leave ortho to us. Excuse me. We've got Dr. Jason, who's absolutely fantastic at restorative and absolutely fantastic with kids as well. So we've got people in their little niches already. And whilst I'm actively encouraged by my peers and my colleagues to take on implant cases, ultimately I've got to be picky with how much information I can take on at any one go. So for me, I want to feel confident with ortho. I want to finish off. So my mental goal is I want to finish 10 fixed cases before I even look at restoring implants, let alone placing or anything else.
No, that's fair enough. So, as a clinician, we all reach a certain point when we start to contemplate practice ownership, being a specialist, or being a super dental GP, or even starting a family. Can you share your thoughts on that?
I'm a lost soul.
You tell me what I am, and that's what I'll be.
Okay. Starting a family, I need a partner first. Running my own practice, I've considered it a million times, and every time I work at a clinic where I think things could be run a lot better, every time I'm in a situation where I don't feel appreciated as an associate or at any kind of negative or anything like that, the thought crosses my mind, what if I ran my own practice? Now I've run the numbers, and at this point in time, especially if you want to open in Melbourne or Sydney, and Melbourne's home for me, so if I was going to do it, it would probably be Melbourne. Running a clinic at this point is as profitable as being a really, really good associate. So then what's the other advantage of running your own clinic? Having clinical autonomy. Well, guess what? I work in dental Disneyland. I've got that. What about having your own say in materials or equipment? Again, already have that. What about asset building? And yes, you can 100% build your assets, but we have the luxury of most dentists being commission workers. So we don't really have a ceiling to our income. It's what you're capable of doing. And yes, you could always have people, you can always run and manage other people and get other people to generate profit or income for you. But running a dental clinic isn't the only way to do that. And when you look at the stress of managing people and overheads and insurances and all the rest of it, dentistry is stressful enough, dude. I don't think I have the heart or the mind to take on that additional stress of being a dentist and a business owner. So when I look at both the numbers and the physical and mental toll it would take, I came to the conclusion that it's not worth my time. So I'm not really looking at clinical ownership, and that's something that everyone who does look at ownership really does need to consider. What's your main reason for ownership? And if it's again, if it's a matter of having autonomy over materials and clinical work, and you can't find a practice where you can be an associate and get that, fair enough. If it's for profit, then really just look at your clinical dentistry first and make sure that it all lines up. For me, it doesn't make sense. Being a super GP, again, it's a matter of how far do you want to go with that, because everyone aims to try and be a good dentist or the best they can be. Does a super GP to you look like being a jack of all trades? And well, with the description I sent you, I mentioned aiming towards being a jack of all trades, but that's not entirely true either. I don't expect to be an expert in endo or an expert in seeing kids. To this day, I'm still really awkward as heck when it comes to seeing kids. But it just means that I just want to be the best I can be in every aspect of dentistry.
Yeah. The one that you missed out on answering was about the specialist. Specialization.
It's on my mind. But the problem is I keep changing my mind. So I don't know if you recall, but when I first joined dentistry, I went in with the goal of being a periodontist. And the specific reason for that was when I was volunteering in Kenya and Tanzania, I came across quite a number of cases of canker moras. And looking at the specialist teams that were involved with that, you had oral maxillofacial surgeons, plastic surgeons, you had prosthodontists creating the obturator devices and whatnot for rehabilitation, and you had periodontists who were involved as well. So that was something that I was considering at one point. And that's kind of where it came off as. After I graduated and during my first year of practice, I was taking out a lot of teeth. It would be anywhere between 50 to 60 a week. It was ridiculous. And working with the oral surgeon as well, it meant that maybe I should do oral surgery. There is that UCID program to be an oral surgeon. So that was on my mind. Mm-hmm. And then when I joined up with Sam, again, I was thinking about perio, but then he also got me thinking about cosmetic dentistry, which was a lot more all-inclusive. And that's when I started thinking, oh, okay, so if I really want to apply all these skills, these ortho skills, these pros skills, the perio skills, to bring it all together, the surgery skills, To be a cosmetic dentist means that you can still specialize, but then you're kind of narrowing your field. And that's when I started to think more like, okay, what if I was a general dentist that kind of looked at the bigger picture? And so that's kind of where I'm at now. That being said, I've had sedation dentistry thrown at me a couple of times, so that's on my mind as well now. So I don't know.
Not there
I
yet.
don't know what
Watch
the
the
answer
space.
is.
Watch the space, basically.
Watch the space.
Yeah.
But anyone who's, maybe 50-50 about it, give it a couple of years, do some general practice, because there's a good chance that you might change your mind. I know with my brother, for example, with prosthodontics, when he graduated, he swore through his teeth that he would never, ever, ever consider being a prosthodontist. And well, here it is now. When I was going through dental school, I swore through my teeth that I would never, ever, ever touch ortho. And here I am now. So, it's you get such a limited idea of what you can or can't do, what you do want to do, what you don't want to do in dental school, and even in your first couple of years of practice. So it does take some time and some exposure to really figure out what you want to do.
Yeah, I mean, to your point, like you're shaped by the people who you meet, your mentors, guide you, and their passion will kind of, pass on to you. And so that can really set you in a different path to what you may have initially planned.
Yeah, 100%, 100%.
So what's the most interesting case you've ever worked on, and what did you learn from it?
The most interesting case is one that I'm actually taking on that I'm in the middle of, and it's the first thing that comes to mind because it's truly an application of everything that I've learned so far. So I've kind of built up a fair amount of experience doing injection molding, to the point that I'm pretty much smashing out resin veneers via injection molding at least once a week, if not once a fortnight, so something along those lines. So we've got that. We've got fixed ortho, and I had to. I actually went back and checked with a couple of my mentors through POS, as well as a couple of the orthodontists that I regularly refer to get their feedback on this case. And I'm looking at the whole principles between prosthodontics, so talking to my brother, and full mouth rehabilitation, so talking to Michael about this case. So there's a lot of planning going on, and there's a lot of back and forth. And sorry, what was your question?
What was the most interesting case? This being the case that you're talking about, and what did you learn from it?
As far as what I'm going to learn from it, I don't know yet, but it's fantastic in that it is to give you some idea of what's going on here. We're talking about an ortho relapse case, which was initially treated 15, 16 years ago, using dentistry principles that we don't apply anymore. So orthodontics in modern day looks at the profile and looks at fitting the ortho around the face. Once upon a time, it was fitting the face around the ortho. So he was treated with that principle. And fast forward to nowadays, when we look at the case, we go, yeah, that might not have been the most suitable treatment for him here and now. So he's a relapse case, and he comes in and he says, just fix it and do exactly what they did in the past and just close up all those spaces and I'll be happy. And we look at that and show it to my mentors and to the other orthodontists and to my brother and to Michael, and we all agree on the same thing. We should not do that. If we close all the spaces, we're going to make this bite even deeper. This guy's bruxic. He's already wearing down his teeth to kingdom come. His lateral and central incisors, they're already worn down to the point that there's only about 1 millimeter thickness until the pulp is exposed. Not a good idea. So instead, what we're doing is a combination of, aligning first, and then using resin veneer work for a dull appliance, and then posterior disclusion, and then using ortho so that it's a controlled dull movement, and then going back to the resin work and changing that back over to porcelain to close spaces to secure the bite. And so this kind of back and forth, it makes me think, oh, if I was an orthodontist, I wouldn't be able to do all of that. I wouldn't really be able to utilize going back and forth. If I was a prosthodontist, I wouldn't be able to utilize the ortho component here. It's just very, very satisfying to put this plan together, and I'll let you know how it goes.
Again, watch this space. Watch this space.
Well, yeah, watch this space. It could be a complete failure.
So you've mentioned already quite a few people who have been pivotal in your career path so far. Has there been anyone left that you would like to give a shout out to, and why?
Colleagues such as James Tran, so he's really good for bouncing ideas off of. I see him maybe once every 3 or 4 years, but we're constantly messaging each other about different cases and how to tackle it. And it's mostly me just getting whatever advice I can from him.
James Chan's
Johan
also
Choi.
a previous guest we've had on this show. So if you want to find out more about him, go check him out too.
Awesome. Johan Choi and Bar Agrawal more recently when I attended their Stratum BXY course. And they're constantly updating you with cases, and everyone who attends their courses, they're all put into a group chat together, so we're constantly bouncing off of each other as well, and that's really lovely to see that they create this kind of community that can do that. And again, just really good banter with Johan. You actually, I'd give a shout out to you. Because out of all the people that we graduated with, there's very few people that I actually keep in touch with. And even though when was the last time we met in person? It was many years ago.
Yeah.
Despite that, we're still constantly in touch, thanks to Instagram. And it's always just good to, again, just bounce ideas off of, or just to talk dentistry. And it's always nice to have people, be surrounded by people, whether it's in person or virtually, to talk about dentistry with, to talk about your passions with.
Yeah. I don't know how to answer that, but thank you so much. I feel the same way about it. I'm sure we'll be leaning on each other more, So, look, there's a lot of struggles that we have in CPD or in our dental journey, Are there any particular ones that you would, some of our viewers might not know about that you're happy to share with us?
Are there any, what, sorry?
Have there been any particular struggles in your dental journey so far that some of our viewers might not know about that you're happy to share with us?
Well, I can't say in particular detail, but make sure that when you pick your practice that you work for, you really do your due diligence. So there are plenty of jobs available. The more dentists that are being pumped out, the more clinics that are opening. So there's always going to be heaps of jobs available. But there is a difference between heaps of jobs available and heaps of good quality jobs available. And it's not up to the clinic to determine where an associate goes. It's up to the associate to determine where the associate goes. So that means that you look at your contract, and if there's any problems or issues or concerns that you have, you bring it up with the clinic owner or the practice manager. And if they're not willing to answer those questions, that should raise a flag for you. You should be willing to, they should be willing and open for you to review contracts and go to a lawyer as well. In terms of mentorship, you need to have a clear idea in your mind, what exactly does mentorship look like? Because it's all well and good. Every associate that goes out to interview, they always say, I'm after mentorship. But 9 times out of 10, they can't actually tell you what does that actually mean. So have a clear and defined image. So that might mean that you want someone to go through every single case with you. That might mean you want someone to pick a random case and go through that case with you once a week. It might mean that you just need someone to us that has an open door policy and is ready for you to ask 1,000,001 questions and can give you 1,000,001 answers. It might mean that you need someone to, give you an assignment and to work through that together. That's different for everyone, but you need to figure out what it means for you and make sure that wherever you're working can deliver that. Or if you can't find that in the clinic itself, that you have an external source that can provide that mentorship that you're after.
Yeah. I think you beat me to the question. So, which leads me to my next question, which is, what's your mentoring style?
Oh, crap. Swear words allowed? I don't know. Really, really bad sense of humor. It really depends on the student, or I guess currently my mentorship.
Let me reframe it for you. So obviously you're mentoring, at the university, right? I mean, you've got different students coming out to you, either asking you for advice and stuff like that. What would you hope that they could do to get the most out of you? What would you like them to do? Would you like them to ask you more questions more frequently? Would you like them to go and study more and then come back to you? So, I'm just spitting here, but you get my gist.
I think my pet peeve is when they have no answer to a question, or they look blankly at you and say, I don't know, what do I do?
Which is very typical of what,
It's very typical.
Yeah, of what a
It's
student would
very
be.
typical.
I mean, you and me, when we're sitting there, we're probably doing the same thing. We would rather be spoon-fed the information as to, come out with you. But yes.
I would much rather you give me 101 wrong answers than look at me with a blank face. So, when I ask for a differential diagnosis, give me all your potential diagnoses and give me the rationale or the logic behind it, because that way we can then correct the logic and go through that together. Whenever I do mentor with these kind of cases in clinic, it's a matter of just looking at the logic behind something. So a good example is using matrices. Oh my gosh, my English has gone
Just for
to
our audio listeners, he didn't just pass out and then just come back, but yeah.
Oh no. So I'm going to rewind. I'm going to talk about a case. I'm going to talk about something that I taught the second years. So they looked at me and they asked me, what's the ideal matrixing for a canine? And I asked them, okay, what's the aim or the goal or the logic with using a sectional matrix? Why do we usually use that for posterior teeth? And the aim or the goal is to create a circular or almost a square-shaped kind of contact area. Whereas with anterior teeth, we can use sectional matrices as well in a vertical direction, or use clear strips. But we're aiming, the goal there is to create a ovoid or a rectangular shaped contact area, right? So your canine is kind of like your upper canine is kind of like your transitional tooth, where you've got one side that's posterior and you've got one side that's anterior. So then the ideal answer for matrixing for a canine is, in an ideal, situation with a Frisacco or Columbia model, is using a sectional matrix on the distal and using a clear strip on the mesial, or using the sectional in a vertical direction on the mesial. So it's kind of like talking about the logic behind things as opposed to just spoon feeding answers. And in terms of outside of dental school, when I'm mentoring groups, that in those settings, we're usually in a cafe, having a bit of brunch, and on my laptop, and I'm usually kind of pointing it away from the general public because no one wants to look at teeth when they come to a cafe, except for dental students. I'll chuck on a couple of cases and we'll just smash through it. And the usual style there is just, here's a bunch of pictures. Give me the problem list. Give me what the solution would be. Then we can work out, how do we get that solution? What can we do to achieve that solution?
Yeah. And did you kind of figure out that that's your mentoring style? Did you stumble across it after, trying to figure it out earlier on when you were, looking at 4 different mentors?
Yes, it's also kind of how that's just how we were taught.
Sorry, you
with
just
our
a little bit
ILAs
off
always.
because of the audio. Can you repeat that again?
Oh, sorry. My brain's going to mush.
I'll repeat the question. So let's say, would you say how'd you kind of develop that style? Did it change from when you first started because of the different mentors that you kind of came across, or?
Yes, yeah, that 100% changed as each mentor came by. Looking at what worked well for me with Sam, looking at what worked well for me with my brother, looking at what worked well with Michael and Dustin. Dustin being my current influence, and he's a person that I'll go to at the end of the day and just throw a whole bunch of cases at, and he'll throw ask me 1,000,001 questions. And also looking at my own learning style. So did I retain knowledge and information if the information was spoon-fed to me, or did I retain the knowledge and information if I struggled to come to the answer? And the answer is, when you struggle, you memorize that information so much more. So I'll throw problems at students, and I'll ask them 1,000,001 questions, and I'll try and guide them towards the appropriate or the most ideal answer. But very rarely will I actually give the answer right from the get-go. If someone turns around and says, "What would you do in this situation?" I would turn around and ask the student, "What would you do?" And they'd say, "Oh, I need this information." It's like, okay, cool. How would you get that information? "Oh, I'd do a cold test. I'd do a percussion. I'd take a PA." I'm like, good answer. Go do it.
Yeah, no, that's fair enough. I want to pivot a little bit. You were part of the ADA South Australia recent graduate committee at one point. What are you getting up to, or what achievements are you most proud of?
So I've been a part of the recent graduates committee for the past 2 years. I'll be honest, the first year that I was with them, actually 2.5 years now. The first year that I was with them, I was working mostly rural SA, so I didn't actually get to participate very much, except for the occasional Zoom call in and say, "Hello, do you need quorum?" Cool, I'll put my hand up. The following years, though, is it's been more along the lines of just attendance and just really getting the word out there that there is a association, almost like a union for dentists that's available to us and provides a lot of support in terms of CPD and education. In terms of if you're a part of Guild Insurance and Indemnity, they've got a lot of support there. In terms of professional networking, and especially when you first graduate, and especially if you move into state. So you're originally from Sydney, I'm originally from Melbourne, but we trained in Adelaide, which meant that when we moved back to our respective states, we didn't have as much of a professional network readily available to us as those who would have trained locally in the state. Mm-hmm. Having ADA as a branch and a committee that you could then go back to just meant that you instantly had a network and resource available to you to then look up specialists and talk to other colleagues or other dentists that are maybe a few years out, and having mentorship readily available, or having people that you can at least talk to readily available to you.
That's fair enough. So a lot of our listeners, are young and hungry dentists who are trying to achieve large goals, So I want to ask you, what success looks like for you, for yourself in the future?
At this point, I have absolutely no idea because I'm a lost soul. Success at this point looks like having a, so if we're talking about financial success, then it's a diversified portfolio. So not using dentistry as your only source of income, which became blaringly obvious during the pandemic and during lockdowns. In terms of clinical success, it's being confident enough to know what my scope of practice is. I'm still figuring that out. I'm still taking on challenges, and when things get a little bit hairy, calling Michael or Dustin in to bail me out, or referring to a specialist when need be. So being able to go, no, that is a case outside of my wheelhouse, I'm referring straight away, versus, oh, let's see how we go. Having that understanding of your own limitations and scope, that's fantastic to me. Being more confident seeing kids.
Well, I mean, you're dealing in the realm of orthodontics, fixed orthodontics for that as well. Naturally, you would have to deal with kids.
Yeah. Well, I mean, look, that's actually helping me build up my confidence a lot more, because what you have to do in fixed ortho, tightening wires and bending wires into brackets, it does create a little bit of soreness and discomfort with your kids. So being better at managing that is absolutely essential, and it's something that I'm building up my skill with. In terms of social or family and success, it's achieving that work-life balance. I don't think I'm at that point yet, especially working around including studying and mentorship and everything else. I think I devote about 70 hours a week to dentistry. So I'd like to drag that back down a fair bit. And I know I'm talking to you, who devotes a lot of your time outside of clinic to dentistry as well. But
we can save that for another episode.
Yeah. But
so do you have any wise, just to wrap it all up, do you have any wise words of wisdom for the budding young dentist? What do you think are the key skills and attributes that they should focus on developing?
Communication. 100%. Communication and photography. We're in a more litigious world where documentation is everything. So more photography, the better. The better quality photography, the better. And in terms of communication, if you can deliver a treatment plan, now it doesn't mean that you're going to be providing all the services as part of that treatment plan, but if you can deliver a good holistic in the sense of everything to do with the mouth treatment plan, your patients will appreciate and love you so much more for it, and you will gain a lot more clinical experience that way. That will open up more avenues for you, that will create more opportunities for you to learn what you want to do, what you can and can't do. But if you don't have the communication in the first place, you don't get the clinical experience, and nothing else follows.
That's a good point. So one of the things, as graduates, we struggle to find the right practice to work at. What are one of the ways that you find helpful in finding the right practice?
So for me, I've always found it really, really handy to be able to interview the interviewer. So, when we go into an interview, the aim of the game is for the clinic to find their ideal associate. But it's just as important, if not more, well, for yourself anyway, ways to find the ideal practice for you to work in. So making sure that you, again, understand the right kind of questions and what you're really after. Do you want the right kind of mentorship? Do you want the right kind of facilities available? Do you want another associate or a senior clinician to be working next to you? What kind of fees are you willing to work with, and what can you back yourself up with? So getting all of those answers, understanding what's ideal for yourself, understanding what's industry standard, that's really, really important. And then being able to fire those questions confidently and practice in the mirror while you're doing that, but firing those questions confidently at your interviewer. Be absolutely certain and be ready to find out whether that practice is suitable for you. And again, know what the red flags are. So for me, if a practice owner ever turns around and goes, "That's not important," well, I know that my values and theirs don't align. If they ever turn around and say, "I'm not willing to negotiate on any of the above," then I know that I have no leeway. Don't be afraid to push the boundaries a little bit as well, because ultimately, if someone's really hard in their ways in terms of my way or the highway, is that a practice that you're willing to work in? Is that something that you're flexible with? And if you're not, then you already know what your answer is.
Yeah, but Dr. Vineel, like sometimes when I'm a new graduate, right, I have no experience. I'm just looking for work and I just want to get my hands wet. And I don't want to be waiting forever looking for the right practice. I mean, I don't feel confident. Like, how do I, but I know but I know or don't know what I want. How do I find what I want? I don't know, like I know myself sometimes, is what a graduate would say.
Okay, well, I mean, most new graduates, want to get experience, right? So then the question is, what kind of clinical work are they offering for the new graduate to take on? And if they have any kind of limitations or restrictions, then you know that it's probably not a practice for you, where they're already filtering out what work you can or can't do. If it's all about experience for you and that's your priority, that's fine. Ask to look at the books, and if they're not willing to show you the books, again, that should be a sign to you that you're not going to get that experience at that practice or at that clinic. So figure out the metrics. I'm not saying wait until you find wait forever for the right opportunity, but I'm saying don't jump into things. Do your research, do your investigation, because ultimately, where you work is your second home. You want to be happy where you're working.
Yeah. For ourselves, like, and for myself, one of the things I've found that really helps for me, it's kind of, and I put this analogy to some of the other people that asked me, is kind of like you're looking for the partner, right? You got to meet a few people, and then you got to go on a few dates with them. What I mean is, like, you probably, and this is probably a bad analogy, but basically, yeah, you had the initial discussion, things are looking kind of okay, but you're not sure if you're fully committed for this this job. So no, you go on a few more dates. And what I mean by that is, like, you might go there, spend a few days, observe the practice, see how they run. And if that works for you, and you get an opportunity to see how they do it, or even talk to some of the other associates that are there, and if that works for you, then great. Then this is a better fit. But if it doesn't, then you carry on.
Absolutely. And that's when you can also ask them questions about the cases that they're seeing then and there. And if they mentor and if they talk about those cases and try and teach and mentor you, and it's a mentor style that you can appreciate then and there, then you already know that they're a good fit as a mentor in terms of clinical experience and the rest of it. But if they say, "No, this is just how I do things," and don't really elaborate further, you're already getting a bit of a taste of what it's going to be like working for them in the long run.
Yeah.
In terms of also following through with what you're saying in terms of the second and the third date, it may be worthwhile having a second interview with them. It may be worthwhile spending a day or two in their practice. And going back to contracts as well, it's worthwhile making sure that you're reviewing through your contracts fully and well. Don't sign on the day. Take the chance to compare with your colleagues or with another senior clinician before you jump into anything.
Yeah, definitely. You're saying definitely seek some professional opinion beforehand, hey?
Absolutely. Absolutely.
So Dr. Vineel, thank you for coming on the show today. If you could let the people know how they can find you.
Best is Instagram at dr.vineel. I also have one YouTube video. By all means, look it up if you want to learn how to brush your teeth, or if you want your patients to not hit back with that excuse of, I forgot everything you told me about how to brush my teeth. So that's, again, Dr. Vineel, Dr. Vineel. And I do have one or two videos on TikTok, and that's at a punny dentist. Yeah.
We'll definitely leave it on the show notes below. For our viewers, if you like this episode, drop a comment below in your favorite part, but don't forget to like and subscribe, and we'll see you on the next episode of CPD Junkie podcast. Thank you.
Thank you. Bye.